Hello, aspirants. Good day. Hope you all are doing good. We will be discussing about another important topic, National Family Health Survey. National Family Health Survey. In any exam, any competitive exam, if you are going to give an attempt, compulsory there will be a question from National Family Health Survey 5, 6, 4. So last time when you pick up TGPSC question papers, there was comparison National Family Health Survey 5 with 4, 5 with the 3, and also 5 with the socio-economic outlook and all. So we need to focus on this area in a broader spectrum, and also microscopically we need to study this topic, National Family Health Survey 6 highlights. We will be looking into the few important aspects of this report, what it is talking about. Why it is in news? Because there was an article recently with regarding to this. India recorded improvements in maternal and child health, while National Family Health Survey 6 reported rise in lifestyle related diseases among adults. Lifestyle related disease, what do you mean by that? What do we mean by lifestyle related diseases? Example, diabetes, hypertension. So all these diseases are basically linked to your lifestyle. If our lifestyle isn't in proper way, if you are consuming excess amount of glucose or excess, if you are pressurized a lot, then automatically, so which is your lifestyle, everyday lifestyle, which eventually leads to several lifestyle related diseases like diabetes, hypertension and all. Okay, so it presents, National Family Health Service 6 presents mixed health picture, combined gains in institutional care, immunization and nutritional indicators. So alongside it is there is a growing burden of obesity, higher blood sugar, a sign that India is now managing both undernutrition and lifestyle diseases simultaneously. So the good achievement for us is that the report states that we have achieved good with respect to institutional care, immunization as well as nutrition indicators. So what the government can do with respect to that, giving immunization, giving institutional good care, increase in number of hospitals, increase in number of doctors. So nutritional indicators, they all can be done with respect to government, and the government is trying to do from it. So but with respect to, alongside, we are also managing the other kind of diseases like obesity as well as high blood sugar. Next one, so National Family Health Survey, what it is about, it is a multi-round large scale survey conducted representative sample of households across India. So across all the households, it has been conducted. So from the year 1992, 93, 92 and 93, from then the National Family Health Survey has been recorded as well as conducted. Its objective is to provide district level data on health. It is basically a bottom up approach of recording the health status of our citizens, family welfare for evidence based policy making. So if we have to set up a good hospital in the area, we need to understand the health aspect of the citizens living in that area. So that is the reason National Family Health Survey help us to understand the ideology, the health status of people living in that area, and program implementation. If we wanted to have a program with respect to immunization, so if there is a drive of immunization in that area, automatically we need to know the health status of the area. So to know the health status of the area, National Family Health Survey will be helping us. Okay, so it is released by, who conducts and who releases this? International Institute of Population Sciences, Mumbai. International Institute of Population Sciences, Mumbai. International Institute of Population Sciences, Mumbai. So remember, many of the times in exam they will ask you Central Potato Institute is located at, Rice Research Institute is located at. So similarly, International Institute of Population Sciences is located at Mumbai. So these questions will be straightforward hit. If you don't know, you don't know that those questions. That is why. So you need to remember these questions. It is a nodal agency designed by Ministry of Health and Family Welfare for coordination as well as technical guidance. Ministry of Health and Family Welfare, International Institute of Population Sciences, Mumbai. So next one, so when where how many people did they survive and all. So this is the crux data. It was conducted during 2023 and 24. 23 and 24, 6.79 lakh households were covered, 715 districts were covered, and 100% data collection. Computer based data collection was taken, 100% computer based data collection, 715 districts were covered, and 6.79 lakh households were covered. Okay, so new areas covered under National Family Health Survey 5. So remember these also. We need to make a note that Manipur was excluded. So Manipur was excluded. So we all know the reason, because Manipur is burning, right? So that is the reason. It will be very tough for the people who conduct survey to go there and collect the data, to finalize data, and people do not support for the governance. So that is the reason Manipur was not calculated in National Family Health Survey. Probably in future they might do. So new areas covered were direct benefit transfer, self-help groups, digital literacy and digital financial transactions, expanded clinical, autopometric, biochemical testings, including HIV testings. So now government has included DBT, SHEs, digital financial transactions, CAB testing, including HIV also. So 6.79 lakhs, 715 districts, 100% CAPI based. Next one, so to know the maternal health, what are the indicators they have used is institution deliveries, antenatal care, mothers who visit greater than 4 times antenatal care visit. So antenatal ANC visits. So greater than that. So next one, births by skilled health personnel. So institutional deliveries in 5 National Family Health Survey 5 were 88%, but now 90%, which showed an upward trend, which showed an increase in the percentage of institutional deliveries. So institutional deliveries, which means previously, if we take about 50 years back, any women who were about to deliver a baby, they used to deliver baby inside the houses. But as of now, so access to institutions like either primary healthcare center or secondary healthcare center, or so district level hospitals, or multi specialty hospitals, so the accessibility to those institutions has been increased, so whereby so institutional deliveries has been increased. Now a woman is going to institutions, hospitals or primary healthcare centers to have delivery. So that is institutional deliveries. So institutional deliveries increased from 88.6 percentage to 90.6 percentage, which means out of 100 babies born in our country, so 90 babies are born in hospitals, in either primary healthcare centers or in hospitals, whatever the government providing, whatever the institutions we are having. So next one, antenatal care coverage. So which means after delivery care centers, after delivery care, 92.6 percentage, which increased to 95.9 percentage. This has also shown upward trend. So mothers with greater than 4 antenatal care visits, so 58.5 percentage to 65.2 percentage. Births by skilled healthcare personals. So those who are going to give delivery, who are skilled healthcare personals, from 89 percentage to 91.3 percentage. 89 percentage to 91.3 percentage. Overall, there is increase in maternal health with respect to National Family Health Survey 6. There is increase in institutional deliveries, there is increase in antenatal care. So mother with greater than 4 ANC visits, birth by skilled healthcare personnel has also been increased. So which actually reflects there is consistent improvement. Which reflects the impact of institutional delivery, incentives, expansion of healthcare infrastructure, and greater antenatal care outreach. greater antenatal care outreach. This is about maternal health. This is about maternal health. While coming to family planning, so contraceptive preventive rate has increased from 66% to 69%, which is an upward trend. So unmet need for family planning, so 9.4 percentage to 8.5 percentage, which has shown decrease in the trend. Unmet need for family planning 9.4, which decreased to 8.5. So total fertility rate, which is quite important, 2.0 percentage to 2.0, so which is static, which did not change. Total fertility rate of India is 2.0. 2.0. So India's total fertility rate remains stable at 2.0 per woman, so below the replacement level of 2.1, indicating that population stabilization, which is aided by rising contraceptive use. Here we see there is increase in contraceptive use, and declining unmet need continues to hold across the survey round. Okay, continues to hold across this survey around. So next one, child health and nutrition. So with respect to child health and nutrition, so they calculated the following parameters. First one, full immunization 12 to 23 months. Next, measles vaccine second dose, rotavirus vaccine coverage, stunting under 5 years of age, severe wasting under 5 years of age. So in the comment section, kindly let me know what is stunting as well as what is wasting. So define what is stunting, what is wasting. Clear? So let me know in the comment section. Next, full immunization 83.8 percentage, so which increased to 87.1 percentage. There is increase in trend of full immunization from 83.8 percentage to 87.1 percentage. Measles vaccine 58 percentage, 58.6 to 71.8 percentage, which has shown increase in trend. So rotavirus vaccine coverage from 36.4 percentage to 85.4 percentage, which has also shown increasing trend. Next, stunting 35.5 percentage to 29.3 percentage, which has decreased. So stunting has decreased from 35.5 percentage to 29.3 percentage, whereas wasting under 5 years, so 7.7 percentage to 5.2 percentage, 5.2%. These two values are very important in n number of examinations they have asked, and even in any, you can quote them in your general essay, or you can quote them in any of your answers. Like India's progress can be seen from reduction in stunting as well as wasting. Stunting reduced from 35 percentage to 29 percentage, wasting reduced from 7 percentage to 5.2 percentage. Okay, so here the sharpest points to be noted are, so rotavirus vaccine coverage nearly double. So clear? So see here, the rotavirus vaccine coverage has been nearly doubled from 36 percentage to 85 percentage, while stunting and wasting both decline, so signaling real progress on nutrition, even though undernutrition levels remain a public health concern. This is all about the child health as well as nutrition. So next one, so we have the most concerning topic with respect to this, concerning aspect with respect to this National Family Health Survey 6 is that, so lifestyle related diseases, which are a major concern for the government as also for us, like, so overweight or obese 15 to 49 years of age, women are 30 percentage overweight, 30% of women are overweight, so men 27.3 percentage of men are overweight. Next, high blood sugar, so National Family Health Survey 5, 13.5 percentage, men 15.6 percentage. So high blood sugar is more in men according to National Family Health Survey 5. So while with respect to National Family Health Survey 6, so 17 percentage of women are having high blood sugar, so 20 percentage of men are having high blood sugars. So hypertension, National Family Health Survey 5, we are having 21 percentage of women are having, so high hypertension. So next one, men are having 24% of men are having hypertension as per National Family Health Survey 5. So next one, hypertension National Family Health Survey 6. So 19.4 percentage are having, 19.4 percentage women are having hypertension. So 22.1 percentage men are having hypertension. So as per this, overall on an average, if you look at, so nearly 20 to 25 percentage, 20 to 25 percentage of both men and women are being suffered with this hypertension, high blood pressure. Clear? So overdose, overweight or obese. So which means one fourth of our population, one fourth of our population are suffering extremely with hypertension, high blood sugar, overweight, obese. Clear? So this we need to note. Lifestyle diseases, which is a rising concern. So next one, here we have maternal mortality rate, so which is very important. But here let me make a point that maternal mortality rate was not mentioned in National Family Health Survey 6. So earlier reports, earlier National Family Health Survey 5 and 4 were talking about so maternal mortality rate. So National Family Health Survey 6 do not include mortality rate. These were among the indicators dropped as fact sheet was condensed. In any case, is not part of National Family Health Survey indicator at all. So India's MMR comes from Registers General Sample Registration System. Okay, so this is quite important. These values are important because they asked in n number of examinations. Arrange the following states based on MMR. Arrange the following states based on neonatal mortality rate. So maternal mortality rate per 1 lakh live births, how many how many mother actually expired. So that is the study. So into 2018 and 2030, 2020, 2018 to 2020, so it was conducted Kerala. So 19, Telangana 43, which is very important in many examinations. They have asked Tamil Nadu, Gujarat, Maharashtra, Andhra Pradesh, Jharkhand, and Karnataka. So we are standing on the, Telangana is standing on the third position. Kerala first, next Maharashtra, next Telangana, next Andhra Pradesh, Tamil Nadu, Jharkhand, Gujarat as well as Karnataka. Clear? So this is about maternal mortality rate. We will see few important prelims as well as mains questions with respect to National Family Health Survey 6. Consider the following statements regarding National Family Health Survey 6. It was conducted during 2023 and 24, covered all states and union territories of India. So which is an extreme statement. We already discussed that Manipur was excluded from this. Clear? So Manipur was excluded. We all know the reason. It was released by International Institute for Population Sciences, Mumbai. Yes. Next, it fully adapted computer assistant personal interviewing for data collection. Yes. Options 2 and 3. So next one, with respect to findings of National Family Health Survey 6 compared to 5, consider the following statements. India's total fertility rate has fallen below 2.0. I told you the fertility rate remained stagnant, 2.0. The prevalence of stunting among children under 5 was declined. Yes, it was declined. Hypertension among adults has increased for both men as well as women. So no, it was not like that. It did not increase both for men and women. So that is why option 2 is right. Next question. We will have one good mains question. National Family Health Survey 6 reflects an India moving simultaneously towards improved maternal child health outcomes and rising burden of lifestyle diseases. Discuss key findings of National Family Health Survey 6 in the context and suggest a policy framework to address India's emerging double burden of diseases. So on one hand, we are fighting with communicable disease. On other hand, we are fighting with lifestyle related diseases. So this is the crux. We know that till now what we have discussed, what are the aspects of national family health services, what it is talking about, and it doesn't include MR or neonatal mortality rate. It straightforwardly talks about how we are securing maternal health, child health, family planning and all. So with all these, cover all these aspects, try to give a very good optimistic conclusion. So try to come up with a very good policy, how to have a good health of our citizens. So ultimately, health is wealth. If we secure the health of our nation, automatically everything will be secured. Thank you so much. And unlock your potential. So decode your future. Thank you so much. See you once again.